So I have my proper PPE on, my scene is safe. I only have one patient per dispatch. My patient was having some sort of respiratory distress. As of now, I will call for additional ALS backup. And due to my patient's complaints, I do not see the need to consider C-spine immobilization. So on arrival, my general impression of my patient is she's in the tripod stance, obviously having some trouble breathing. As well on arrival, my patient was alert, so I'll give her an A for alert. She was able to track me with her eyes. So now I'll determine her chief complaint. So hi ma'am, I'm Nicole, I'm an EMT on the ambulance. What's your name?
Marianne.
Marianne. So what seems to be the problem tonight?
I'm having trouble breathing.
Trouble breathing, okay. So now I will do my primary survey of my patient, doing my ABCs, airway, breathing, and circulation. So first I will count her ventilations, watching the chest rise and fall. So she's breathing at about 20 breaths per minute. And now I will listen to lung sounds. Can I have you breathe in for me? One more time. Okay, so I did hear some wheezing in the upper lobes of the lungs. So I will administer the oxygen via the non-rebreather for 10 to 15 liters per minute. And now I'll assess circulation. I don't see any major bleeding that I need to control. My patient's skin is cool. She's diaphoretic, and she looks to seem a little pale. I will now take her pulse. Okay, so her pulse is about 115 beats per minute. As of her condition now, I will make my patient my priority and transfer as soon as possible. And now we'll go into the history taking. So, so ma'am, what were you doing when this episode of trouble breathing started?
I was walking my dog.
Okay. When you were walking your dog, did anything make it better or worse?
The walking seemed to make it worse.
Okay. Do you have any pain?
I have some pain, discomfort in this area.
Okay. Does that pain travel anywhere?
No.
Okay. Can you rate the pain, 1 being not very painful to 10 being the worst pain you've ever felt?
About a 6 to 7.
Okay. And then once again, how long ago did this start?
I would say about a half an hour ago.
Okay. So do you have any allergies?
I'm allergic to kiwi fruit.
Okay. Are you on any medication?
I use an inhaler.
Okay. What do you use that inhaler for?
I have asthma.
Okay. Have you had a asthma attack before in the past?
Yes, I have.
Okay. Would you say that this episode of trouble breathing feels any similar to past asthma attack?
Yes, it seems very similar.
Okay. What was your last the last time you ate or drank anything?
Probably about an hour ago.
Okay. And then once more, what were you doing before all this started?
Was walking my dog, but I did walk her a little longer than I normally do.
Okay. So now I will do my secondary assessment. I will listen to her lung sounds. Breathe in one more. Out. Again. 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 Okay. One more time. Okay. I am still hearing some wheezing in her upper lobes of her lungs. Do you feel like the oxygen that you're on is helping you at all?
Yes, I feel a little bit better.
Okay. So now I'll take your blood pressure, take your baseline vitals. Okay, good. Your blood pressure is 120/70. And now I will take your pulse once more. So my patient's pulse is 96 beats per minute, and I will again assess her respiratory rate, watching the chest rise and fall. Okay, so she's about 20 breaths per minute. So my field impression of my patient is she is currently having an asthma attack after walking her dog longer than usual. Interventions I had done for my patient is I placed her on oxygen via the non-breather at 10 to 15 liters per minute because of her trouble breathing. The oxygen is adequate and her respirations are adequate. I will reassess my patient every 15 minutes until ALS backup arrives, and upon arrival I will provide an appropriate verbal report of my patient's episode of trouble breathing she's having. This concludes my skill.